The robotic hysterectomy involves general anesthesia, 4 small incisions in the abdomen. It is a process by which everything is completely done laparoscopically. You go through the tissue planes as you would a normal hysterectomy, yet you can see the planes a lot better. Everything is visualized with a 3-dimensional camera with great magnification. The organs are delivered through the vagina.
The robotic instruments are small enough to fit in the palm of the hand. Incising of tissue is done with electric energy, which cuts down on blood loss to allow for better viewing and overall faster recovery.
I chose robotic hysterectomy because I like least invasive surgery that's easiest to heal from. Being a naturalist, I like that it's being least invasive to my body, therefore I can heal quicker.
I like the robotic surgery because they have less pain afterwards. They can get back to their busy schedules quicker. They spend less time in the hospital. They have less blood loss, less likelihood of infection.
My surgery was successful. Everything is 100% great. From what I've talked to with other people that had similar surgeries but not robotic, they took a lot longer to heal than mine.
But this technology is not just easier on the patient, but on the doctor as well.
I enjoy it because I see as if I'm inside the body cavity. I can see structures that I've never seen before up close and 3-dimensional. It's much different than looking at an open incision or even a 2-dimensional laparoscopic camera. It's just phenomenal, the visualization, and then really you're sitting down in a comfortable position, ergonomically correct, instead of standing over the patient twisted. So I used to be very, very sore after a long surgery, and now it's just better. You can focus more on what you're doing.
Yes, I would recommend it to other people as well. Robotic surgery and Dr. Roberts for professionalism, her care in the patient before, during, and then lots of follow-up afterwards to make sure everything went well.
I love Restylane because it's a deep dermal filler, and for those women who notice signs of aging, the laugh lines here, that you just lose that fullness, and even in the lips as well, you see instant results. And so they just, by the time they walk out, they can't stop looking in the mirror because it just looks so much better. Women in their 40s, 35, 40, especially smokers or people who have been in the sun, notice that they're just not as youthful. They might look tired and when they had a full night of rest. Those are the perfect candidates.
I decided to try the Restylane because I've been doing some Botox with Dr. Robert, and she suggested it for these lines right here that come down from the nose and around your mouth. That really does age you a lot. And so I thought I'd give it a shot, and I loved it. It's natural looking. It doesn't give your face a plastic look. It kind of takes the edge off of aging, basically. It just fills in enough. It plumps it up a little bit like you had normally when you were a bit younger than I am now.
I believe in nutrition and living right, but no matter what, you're going to see signs of aging. There is no magic pill to keep us youthful. So it helps women feel better about themselves, especially if they're going to go to a reunion, a big party. I tell women, you know, you might see a little swelling there, a little redness, so for the afternoon you might not want to do anything where you have to go out and look, you know, perfect. But really within about 24 hours you're just fine.
I recommend this procedure because it doesn't change your looks. It just takes the edge off of the wrinkles and the aging process. There are no knives, it's not an invasive procedure, and it lasts a long time. Looks good. People don't say, oh, you had some work done. People say, wow, you look rested. You must not be under as much stress as you used to be under. And I say, oh yeah, I'm feeling much better these days.
I think I have the best job in the world. and I think it's because it's people-oriented. I get to listen and be involved in people's lives. I get to offer some assistance to help them feel better. I love that.
She is the absolute best doctor I have ever had with all three of my kids. She was my last doctor, and I wish she had been the only doctor I had ever seen. I felt VIP all the way. Every time I needed anything, I had a very difficult pregnancy, and she was very understanding, very patient, very kind, and I felt very well taken care of. It was also the easiest of all three of my births, so I kind of attribute that to her.
I think I have empathy for the patient because I've been there. I mean, I remember every minute of every delivery, and it's both scary and exciting. And I think if I take myself back to those moments for myself, it helps me. Even if I'm personally tired, even if I've got a lot going on, I can still look at her and say, this is going to be a moment she's going to remember for the rest of her life.
She takes the time to care for me as a person, not just as a patient, and we have a relationship above and beyond just a doctor-patient relationship. She cares about my children, and each consecutive child that I've had, she's asked about the other ones and knows them by name, and about how old they are, and how my life is juggling with 3 kids now. She takes the time to care about me, not just my medical needs.
Well, I love when they bring them to the office if they're here just for their annual exam, and if they're 10, 11 years old and they say, hey, you delivered this one, and I think, wow, that's amazing that this much time has passed. And really just the best thing is being able to see that couple, and especially the dad's face, the first moment that that baby comes out. And there's just nothing more precious than the excitement of that new birth and seeing the look on the dad's face. And he can be a tough, big guy, and there's just tears of joy. And I don't think I'll ever get over that.
Me and my husband just really got to take our time with everything, and she made me feel very comfortable, and any question I had, she answered it for me. And it was just the best experience I'd ever had with a doctor.
I really enjoy what I do for a living. I love meeting the family during the early parts of pregnancy, taking them through the whole 9 months, and then seeing that wonderful moment when they deliver, and then taking care of them as they come back to the office in the subsequent years and seeing their family grow. I love seeing the pictures. It's such a joy. Of course, it's stressful, and I enjoy that as well. There's never a dull moment, and I just really enjoy getting to know my patients.
I've been coming to Dr. Robert now for close to 6 years, and I come to her because I think she's a really qualified doctor and she's taking great care of me.
Well, in this situation, Tracy and I had known each other for quite a while, so we had a unique bond and a trust, and when it came time for delivery, her baby was breech. And so we talked through the different options, and her husband and she listened to those and really made an educated decision and felt that we could try to externally birth the baby, and they felt trust towards me that I could do this. But when it also became apparent that this was not going to work, then they looked at me and they said, okay, we'll just do the C-section. And we all went through it together, and she did beautifully.
My second pregnancy did have a lot of complications. I went into preterm labor at 29 weeks. And so, I started seeing Dr. Robert a lot more regularly at that point, just to make sure that everything was going well.
The key to this scenario of delivering in the operating room is trust, because the patient obviously needs to have her baby, and she's meeting some of these people for the very first time, and so it is a very human relationship there, and that is the key to success, is being able to feel reassured that everything is going to be just fine and that she's being well taken care of.
I really had to trust Dr. Robert at that point because I knew that this C-section was my only option. And I was pretty nervous about it, I really was, but I knew that she was a qualified doctor, and I knew that everything would go smoothly, and it definitely did. He was born without any complications at all.
NovaSure is a procedure and a device that helps women resolve excess menstrual bleeding.
I was very pleased having the NovaSure procedure with Dr. Robert. She explained everything from start to finish. I had 0 complications, and I've been really satisfied with my results. My interaction with Dr. Robert and the staff before and after our procedure is that she explained it from start to finish, what would happen as soon as I walked through the door to as soon as I walked out of the door. And also her staff, I had a really good connection with one of her staff members who explained her personal experience with having the NovaSure procedure done.
The advantages of NovaSure is that in a very short period of time, and that is about 90 seconds, that lady has had her last heavy menstrual cycle. She goes home that day, rests up, and the following day she can go about her normal activities.
When I had the NovaSure procedure, it was quick, it was painless, I had 0 side effects, my recovery was really quick, and any experience with Dr. Robert has been like that. She is awesome, she's patient, she's caring, she's just very hands-on.
The philosophy of my practice is generally taking care of women from an early age on through the different stages of their life, taking them through the teenage years, taking them through midlife, menopause, and all those associated problems that go along with the stage of life they're in, and hopefully preventing them, talking to them about lifestyle and ways that they can hopefully not encounter any kind of medical problems.
Dr. Robert is really just a sweet person, and she has a really good heart for her patients.
I really enjoy what I do for a living. I love meeting the family during the early parts of pregnancy, taking them through the whole 9 months, and then seeing that wonderful moment when they deliver. There's never a dull moment, and I just really enjoy getting to know my patients.
I discovered Dr. Robert through my mother-in-law. When I got engaged to my husband, she referred me to Dr. Robert, and I have just been thrilled with her, and she's just a fabulous person.
Amanda and I discussed the fact that she didn't want any more children and what would be the best thing for her. And we discussed those options. She's young but yet very, very busy. And so when we discussed all of her options, she chose Essure because it was quick, it was going to get her back to her active lifestyle, and it was effective.
I chose to have Essure done by Dr. Robert because I have 3 beautiful girls, and I believe that that is enough for me and my husband, and I trust Dr. Robert with everything, and so I chose her to do the procedure just because I knew she was very qualified, just to assure that the 3 that I have would be all that I have.
In my patients who have received the Essure procedure, I have seen that they are able to move on without spending a lot of downtime or worry. We do prove to them that the tubes are blocked, and so that they can go on and enjoy the intimacy of their marriage relationship, and they can also enjoy their children as they grow up and not have to worry about what birth control pill that they'll be on.
The best part of my care with Dr. Robert, or the experience with Dr. Robert, was just knowing that she was always there for me, that she actually did care for me and my pregnancies and how they went, and knowing that she was a Christian. I was blessed with her being my doctor.
What do my patients say about me? I would hope that they would say that I was easy to talk to, that I gave them a listening ear, that I spent time with them, and that I was able to take care of any problems that they might have brought to me.